This video will discuss how to decrease your chances of having a stroke and heart attack in 10 years. Stroke and heart attack are the two most common diseases worldwide. In the United States alone, these account for 1 in 3 deaths with massive cost to the US healthcare system, amounting to more than $200 billion a year and around $130 billion in lost productivity. 1 out of 4 adult persons above 25 years old will likely have a stroke in their lifetime. 1 in 2 for men and 1 in 3 for women in adults above 40 years old will likely develop disease in their heart vessels, known as coronary heart disease. With this information, it is important for one to know his or her risk to prevent the development of diseases that may lead to stroke or heart attack. There is a risk calculator to determine one's 10-year risk for the development of a condition known as atherosclerotic cardiovascular disease, which increases risk for heart attack and stroke. Those who are determined to be at higher risk are likely to benefit from treatments to prevent the development of stroke and heart attack. Doctors utilize the ASCVD calculator, known as atherosclerotic cardiovascular disease, to determine if the patient is low risk, borderline risk, intermediate risk, and high risk. You can search for this calculator online and plug in the values and you can determine your risk. The calculator looks at the different risk factors such as age, gender, race, total cholesterol, HDL cholesterol, systolic blood pressure, diastolic blood pressure, treated for blood pressure, diabetes, and smoker. So, what does my risk score mean? The ASCVD risk score is given as a percentage. This is your chance of having a heart disease or stroke in the next 10 years. There are different treatment recommendations depending on your risk score. A 0 to 4.9% risk is considered low. Eating a healthy diet and exercising will keep your risks low. Medication is not recommended unless your LDL or bad cholesterol is greater than or equal to 190. A 5 to 7.4% risk is considered borderline. Use of a statin medication may be recommended if you have certain conditions or risk enhancers. These conditions may increase your risk of a heart attack or stroke. Talk with your primary care provider to see if you have any of these risk enhancers. A 7.5 to 20% risk is considered intermediate. It is recommended that you start with moderate intensity statin therapy. A greater than 20% risk is considered high. It is recommended that you start with high-intensity statin therapy. This table shows the list of statins based on their intensity, with the highest being only 2 medications, atorvastatin with doses ranging from 40 to 80 milligrams, and rosuvastatin with doses ranging from 20 to 40 milligrams. Thank you very much for watching this video, and God bless. I hope to see you again in my next video.